Hello everyone, my name is Joel Nunez. In this video I will be showing you the protocol for measuring blood pressure. Before taking someone's blood pressure, make sure they've been sitting down for at least 5 minutes. Their back should be supported and make sure the patient doesn't have long sleeves on their arms. It is also important to remember that their feet should be flat on the floor, with both arms being well rested at the chest to heart level. It is also important to make sure that the patient has not had any caffeine or nicotine at least 30 minutes prior to measuring their blood pressure. Take the stethoscope and make sure that the prongs are facing forward, then give the diaphragm a small tap to make sure that the sound is clear and ready to be used. Before placing the cuff, make sure that the correct cuff size is being used by identifying if the arm fits within the proper range shown on the cuff. Next, you want to make sure that the artery line shown on the cuff is aligned with the brachial artery. Once the cuff is properly placed, you will then place the diaphragm on the brachial artery. Make sure that your thumb is not touching the diaphragm, as the wrong pulse could be picked up. Before pumping the cuff, make sure that the switch at the back is up and not down. This will allow you to begin the process of pumping the cuff. Once at this point, you may begin to pump between 180 to 200 millimeters of mercury. After this range has been sought, keep your finger on the back switch and press it down lightly to where we are releasing at least 2 to 5 millimeters of mercury per second. The very first thump sound you hear is known as the Korsakoff sound, indicating the start of blood pressure or the systolic blood pressure. The last sound you are going to hear is known as the diastolic blood pressure. After blood pressure has been assessed, have the patient sit and rest for 1 minute. Then take it again and calculate the average of the two results. The chart shown before you shows the classifications of a patient. If the systolic blood pressure is less than 120 and the diastolic is less than 80, the patient is classified as normal. If the systolic pressure ranges between 120 and 139, or the diastolic blood pressure ranges from 80 to 89, then the patient is classified as prehypertensive. For a patient to be classified as a stage 1 hypertensive patient, the systolic blood pressure would have to range between 140 and 159, or their diastolic blood pressure would range from 90 to 99. Stage 2 hypertension is classified by having a systolic blood pressure greater than or equal to 160. In addition to this, their diastolic blood pressure could also be greater than or equal to 100. This is a blood pressure protocol. I'm Joel, and thanks for watching.